So that's a little bit of a history of, well, where the meters came from. But as we look at blood glucose meters, are they regulated? So blood glucose meters are in fact considered by the FDA as in vitro diagnostic monitoring devices. And they are considered class 2 or to be a moderate risk device. So an in vitro diagnostic monitoring device is a reagent instrument or system intended for use in the diagnosis of a disease or other conditions in order to cure or prevent disease or its sequelae. So the FDA defines the indications for blood glucose monitors as their intent is for quantitative measurement of glucose by lay users at home or by healthcare professionals in clinical settings to assist in the evaluation and management of individuals with diabetes. Keynote, the FDA does not state that they are for diagnosing or even screening for diabetes. And this is an important point, as many folks at health fairs and other things will use glucose monitors for screening. We need to remember that if you do in fact use a glucose monitor for screening and you get a higher reading than or something that is concerning, that needs to be followed up in with lab in the typical way that we would diagnose diabetes or pre-diabetes. The other important thing to know is that the FDA currently says that there is no distinction between the performance requirements for over-the-counter and professional use glucose meters. So as far as the FDA goes, the systems that we use in our clinics and our hospitals follow the same regulations as the systems that we use at home. And really, the self-monitoring of blood glucose really does take a system. So it's not just the meter that we're talking about or that the FDA looks at. It's really looking at the test strips and the quality control solutions, sometimes the lancing devices, and alcohol wipes. And each system of all these various components are considered to be a separate system and, according to the FDA, requires its own performance and is evaluated separately. So there is an organization that looks at standardization and quality of these meters, and that's the International Standards Organization. And so what you need to know is that they have determined that for a blood glucose device, that 95% of individual readings should fall within 15 milligrams of the result of the reference measurement for blood glucoses that are less than 75. So what that means is that 95% of your blood glucoses that come out at 60 should fall at least 15 milligrams on either side of that. Well, if you think about it, that's a pretty wide variation. If you're at 60, then, well, are you sure that that blood glucose really isn't 45 or 75? And then they say that the standards say that 95% of the individual results for blood glucoses of over 75 should fall within plus or minus 20%. So it's still a very large degree of error that's allowed for these devices. So again, clinically, when you're looking at this and you're discussing this with patients, you need to understand and realize what the variations might be and what is actually acceptable. So why such high variations? Well, as we talked about with the earlier meters, with the early meters, you know, a lot of different things can impact how that reading is that you get. User performance, whether you have interference from things like people's cholesterols or hematocrits, from medications that they're taking, from temperature and humidity and altitude. So all of these things need to be considered when you're looking at the validity and consideration of the blood glucose readings. So, you know, obviously there's some controversy and concern over the wide variation that's accepted in these. And so they're trying to tighten up the standards a little bit. And I think that most folks agree that really we'd at least like to see that 95% of the values that for values that are greater than 75 are not 20% total error, but down to 15, and that the readings below 75 aren't 15 milligrams in error, but 10. You'll find that most of the modern monitors that we use actually fall well within this range, but you just need to be aware that those are the numbers. You know, I put this chart in here only just to talk about and to show you the various things that can result in errors in your blood glucose. You know, things such as, you know, are the test strips expired? We all have patients who hoard test strips, and they end up, you know, grabbing something out of their cupboard that's been there for 3 or 4 years, and potentially that may lead to an erroneous result. We have folks that are on peritoneal dialysis, and those there are less and less meters that are impacted by interference of maltose and xylose and galactose, but those meters that do require GDH PQQ for their reagents are issues and shouldn't be used in those patients. You know, for those meters that still have coding, you know, there are issues of miscoding and that sort of thing. So just be aware that there really are a lot of various potentials for variation and error when you're looking at these. Again, you know, not to kind of drill it home, but here's another table, and specifically, you know, I wanted to call your attention on the peritoneal dialysis issue. You know, the AccuCheck monitor specifically does have issues with regard to folks that are on peritoneal dialysis. They are in the midst and have been in the midst of changing their reagents, but just be aware of that. Other things like acetaminophen or salicylate, also depending upon the type of meter that you are using in your facility, may or may not have issues of interference. The other issue just to be aware is, again, the performance parameters. You know, I find this interesting. So the bare contour meter, you know, is good for down to a hematocrit of 0. So I'm not sure how that works, because I think if your patient has a hematocrit of 0, they're probably not viable. But just to be aware that there are different hematocrit ranges for the different meters. There are different operating temperatures. So for those of us out in Phoenix, where it gets to be 115 in the summer, those are issues that we need to talk about or think about. Other issues with regard to folks that have dyslipidemias with very high triglycerides, how is that affecting it, and which meter may or may not be the best for our use in our patients. So just so to be aware of that. The other thing that, you know, the FDA keeps track on, because it is a regulated thing, is the adverse events and the injuries. And, you know, it was a surprise to me when I attended a blood glucose FDA meeting back in 2010 to find out that actually glucose meters have one of the highest numbers of device adverse events reported each year. You know, these are probably generally underreported, actually, but, you know, there are thousands of medical device reports sent each year. You know, and granted there are billions of tests, but it's still something to be aware of, that, you know, there are, it's not as a benign procedure as we all make it out to be. Some of the injuries, and again, this table just sort of shows what the different reports with injuries were, coming from treatment with medications, and that's interpreted to be a blood sugar was obtained and interpreted in a particular way, which caused a medication to be given, which might have resulted in injury based on an erroneous blood sugar result. And you can see the list of various adverse events or injuries. Just a pie chart that again shows the adverse events and deaths. You know, between the period of time of 1992 to 2009, 100 deaths actually associated with glucose meters. And again, you know, over a period of time, maybe not so much, but again, we use them so frequently, we prescribe them so much, and we think nothing of it. And just to realize that, you know, they are an actual medical device that bad things can happen with. So just to kind of close out, and I wanted to go through that fairly quickly just because I wanted to get to the meat of the actual monitoring, but certainly technology has come a long way. I think we're all very happy and fortunate and appreciate the fact that we're not monitoring people's urine for their blood sugars. I think that we do all need to realize that there's lots of external factors that can influence the accuracy of meters. And I'll say this, and I'll say it repeatedly throughout the presentation, is, you know, as we interpret blood glucose or any lab result or test result, if the result doesn't make sense, then we need to question it. And so, you know, knowing in something like this that there's so many things that can impact that, we need to use our clinical acumen and really our relationship with the patients to have that discussion as to whether those readings are making sense or not. You do need to realize that there is controversy over the accuracy of the current meters. You will find that almost all the meters that we are currently using will adhere to those accuracy requirements and really exceed them, but do realize that they do exist. And then there are a significant number of adverse events reported each year from the use of these machines.